Good afternoon, everyone. We're thrilled to have so many members of our community joining us this evening. For those of you who do not know me, my name is Merz. I'm the Interim Vice President of Development for Suburban Hospital and the Suburban Hospital Foundation. We're also joined today by three esteemed panelists. We have Jacky Schultz, President of Suburban Hospital. We have Dr. Barton Leonard, Chair of Medical Staff and Head of our Emergency Department. And we have Dr. Sonia Qasba, a hospitalist and our staff epidemiologist. Before we get started, I just want to take a few minutes to make a few comments about the objective of our program this evening and review a few housekeeping Zoom items. As you all know, obviously the impact of COVID-19 has been significant in our community and has really completely changed the way we think about healthcare and especially how we think about public health and safety. I've worked at Suburban Hospital for more than 20 years in several different roles, and during that time, I have always been enormously proud of this hospital's dedication to excellence and compassion in patient care, to commitment to innovation in medicine, and especially to the unwavering mission to serve our community. But these past few months, honestly, have truly been exceptional. I've had an opportunity to watch our teams of true healthcare heroes rise to the challenge in the midst of this novel and ongoing pandemic, and it's been truly awe-inspiring. Tonight, we'll have a chance to hear from our experts about how the hospital has responded over the past 3 months, and we'll take a closer look at the situation as it continues to evolve and gain some insight on what we might expect as we look into the future. In addition to marveling at the work that's occurred inside the walls of our hospital and throughout the broader Hopkins healthcare system, I also want to just take a moment to acknowledge the incredible response from our community, from all of you out there who are on the call today. I can assure you that this outpouring of support that we've seen has been felt and appreciated by all levels of our hospital staff, and I know that my colleagues would definitely agree. To date, our community has provided more than $425,000 in emergency COVID funding, which we're putting to great use. I'm pleased to announce that there's actually more on the way. We have an additional grant of $180,000, which will be coming in soon and will be dedicated entirely to support our staff resiliency initiatives. And again, I know my colleagues will be speaking a little bit about that. Our community has also donated nearly 20,000 meals and 10,000 snack items from mid-March to mid-June to help feed our staff. I think we're really well fed, which is great. We've also received countless donations of N95, surgical and handmade surgical masks, as well as donations of in-kind items such as original artwork, potted plants for Mother's Day, Suburban Strong t-shirts, craft supply packs for staff members with young children, produce boxes, and so much more. I know that many of you, from seeing the names, I know that many of you who are participating on the call tonight are among those who have been so generous during this crisis, as well as many of you who have provided your generosity in the months and years prior to COVID. Your contributions have made a huge impact on our ability to respond in such an effective way during this crisis. So on behalf of everyone at Suburban Hospital, I just want to take a moment to thank each of you for everything that you have done for us. Before I introduce Jacky Schultz, who's going to go first in this lineup, I like to also just point out that at the bottom of your Zoom screen, and I'm sure most people are totally familiar with Zoom at this point after 12 or 13 weeks, but at the bottom of your Zoom screen, there should be a Q&A button. Please feel free to use this to indicate any questions as we proceed. We are going to reserve some time at the end for our experts to respond to those questions if they don't answer your questions during the presentation. And do note that we're not using the chat function in this Zoom webcast. So with that said, I'd like to just introduce Jacky Schultz, who's the president of Suburban Hospital, and she'll start this presentation.
Thank you, Cindy. So I want to welcome everyone and really thank you for your interest and support. I want to be sure to recognize on the start of this that we're giving this update on COVID at the end of the surge, but not at the end of COVID. Everything we talk about today, everything you're going to hear has relevance to the months ahead. Because the conventional wisdom is that we're going to be dealing this for a while, maybe forever, meaning it may always be a disease that is around and pops its head up every now and then. Hopefully, we will have treatments and a vaccine, but the virus will still be around. The speakers we have today really do represent the knowledge and leadership that has been critical to the way that we performed during the last few months. And of course, they're going to be responsible for leading us the way forward too. So for them, it's really only the beginning. Now, I want to start with a couple things before we get specific, because Dr. Qasba and Dr. Leonard are going to get specific. Suburban was very thoughtful and very strategic about how we faced COVID. We had a very well-developed plan right from the beginning. And that really did ensure that our patients were safe and our staff were safe. That kind of planning was really critical. And now we're planning for what we're calling steady state. In other words, we've gone back to resuming surgery, and the objective now for us is, we know we still have COVID patients here. How can we run our normal business and take care of COVID patients? What will that mean for us? We didn't put patients together, we kept them separate. And so we're working on that plan. In addition, we're working sort of on what they're calling the Surge 2.0 plan. None of us knows what will happen in the fall, but we all believe that there'll be a flu season. And with that flu season, there'll be COVID. And so we will expect some more business in that sense. I have to also say that being part of Johns Hopkins healthcare system was really a large part of our success during the last couple of months. They ensured that we had access to the supplies and the knowledge that we needed, not only for patient care, but for staff safety and patient safety. Our circumstances would have been very different and less favorable if we didn't have colleagues across the system. That was how we were able to access adequate personal protective equipment. That was how, together with Dr. Qasba, we were able to make sure we were doing processes correctly. So there was never a better demonstration, I think, of the power of a system than the past couple of months. Our staff and leaders were phenomenal. They stayed 100% true to our values and to our priorities. I can't say enough about that. They really behaved like heroes in all of this, and they continue to do so. Now, Cindy already told you about the generosity of the community, and honestly, it was breathtaking and it was amazing. I will say that, you know how people talk about the freshman 15? People now talk about the COVID-19, because there was so much food around. I think it was something like 12 or 13,000 meals that poured in here. And the staff really appreciated it. Coming out of the hospital and just seeing that neighborhood people made some chalk drawings on the sidewalk honoring healthcare heroes. There was this Sunday when the staff looked out the window and saw that people were walking in front of the hospital, all social distance, by the way, with masks on, with signs about their appreciation for the bravery. That goes a long way to make staff feel appreciated. So we appreciate all the donations. We appreciated the community outpouring. Now, really, I want you to hear from the experts, because these two physicians know a whole lot more about how we got through this crisis, and I counted on them to help us get through the crisis. And it starts with Dr. Barton Leonard. Now, Dr. Leonard is about 2 weeks away from not being the current chair of the medical staff, but currently he is the chair of the medical staff, but he remains the medical director of the emergency department. The emergency department was the first stop for all of our COVID patients. So truly, it was the testing ground of all the modifications and processes we put in place to adjust to this pandemic. So without further ado, Dr. Leonard.
Thank you so much, Jackie. As Jackie said, I'm Barton Leonard. I am the third generation of doc to be here at Suburban, so I definitely bleed Suburban blue. I'm dedicated to this place, and I am so proud of how it handled COVID and how it continues to handle COVID. We had something this morning that I think was very enlightening. We had something called a after action meeting. It was led by an outside group, and it's to see how Suburban handled COVID, what we did well, what we could have done better. And it was really amazing to see our nurses and our docs point out all the different successes. They pointed out how nobody called out sick. And I hadn't really thought about that until we had this meeting. No one was too scared to come in, even people that were pregnant with diabetes, that had elderly people at home living with them, etc. Nobody called out sick. They pointed out how nurses were volunteering to take extra shifts because we needed extra bodies, especially during the surge. How the nurses were volunteering for like the toughest, most demanding jobs, in the tent, in the PAPRs, etc. How we helped each other with PPE, educated each other with how to put on and doff and don PPE, and just helped each other with difficult patient care. It was really neat to see, and sometimes you need a debrief like that to really appreciate how we came together as a team. So it was neat to see this morning. I just wanted to share that with everybody. So obviously I'm biased about how great Suburban is, but it really is a special place. And one of the things that makes it real special is that it does have that cozy look and feel of a community hospital, but it functions like an academic or tertiary care hospital. It's a trauma center, it's a stroke center, it's a cardiac center, and now it's a pandemic ready center. And it's got all these top tier capabilities, and that part of it is what draws fantastic nurses, fantastic doctors, and patients here. And there's a reason why, for when I look around, I'm surrounded by docs and nurses that have been here for 10, 20, 30 years. And it's because our leadership has built a great team. It's because we have an amazing president like Jacky, who you just heard from. We have fantastic docs like Sonia Qasba, who you're going to hear from shortly. And then we have the capacity and the service lines and the technology surrounding this team. And that really translates into great patient care. So, this story of COVID at Suburban is really a success story. And we had success because of several different reasons. It's because our leadership had us ready for the pandemic, literally. They made decisions both before and then in real time that put us in a good position to handle the surge. We had success because of you, our community. I really feel like our community did a fantastic job of social distancing, and that kept us away from the New York part of the curve. We had success because of our new state-of-the-art building. Thank God that thing opened up a couple weeks before COVID hit and then before the COVID surge. Without it, it would have been a lot more challenging. But because we had it, we were more prepared than any other community hospital that I know of or that I've heard of. We had entire floors and units that were built to be ready for the pandemic in that new building. We had success because of being part of Hopkins, like Jacky said. It allowed us to have a great supply chain for PPE. It allowed us to have access to all the vents that we needed that you heard about in the media. And we could handle any patients, and we could transfer any patients between different hospitals within the system as needed. And then most importantly, we had success because of our team. And I've never been as proud as I have been in terms of the group of people here at Suburban. This team was just amazing, and they continue to be. So specifically, what do? We changed the way we approach patient care is what we did. And that was in order to keep our patients safe and in order to make sure that our staff was safe. In the ED, we triaged people before they even entered the building. We moved our lovely pediatric unit further back in the hospital, and we converted it to a negative pressure area for people that had COVID symptoms. We created like a hot zone and a cold zone within the ED so that we could cohort people that had COVID symptoms and keep them away from people that were presenting, because people were still getting sick and hurt, et cetera, that didn't have COVID symptoms. So keeping them safe and cohorted and separate. We coordinated with our EMS partners and with our nursing home partners so that we knew what was coming before they even hit our doors, so that we were prepared for them before they even got here. And then once they were here, we actually got them up faster. That was looking back at the data, our length of stay for patients in the ED was actually shorter. And part of that is because we had that new building, and we had the ability to pivot and change so many rooms upstairs to be COVID-specific rooms and units and floors that had negative pressure. And we had specialty trained staff, both at an ICU level of care and a medical surgical level of care. And that allowed us to handle that surge. We also introduced new protocols. We had new IT functionality, and that allowed us to track the patients and to treat the patients appropriately. We deployed telehealth with some of our specialists, and also for families that you know, because we can't allow visitors right now, you know, to communicate with their loved ones. So we just did a bunch of different things that we had never done before, and I felt like we just did them seamlessly. And before I give the mic over to Dr. Qasba, I'd just like to say thank you again to the community for everything that Cindy and Jacky talked about. It meant a whole lot to our entire team. You know, one of the days, that Sunday that Jacky referred to, I didn't know it was going to happen, and I could see there was people going outside, and I saw at the window, and you went outside, and it was just really neat to see people with bells and signs, etc. And you know, some of our most battle-tested ER nurses were crying that day. It's very nice. Anyway, thank you very much, and to the donors, because without that new building, and that new building, it was a lot of donor donation that went into the building and the success of that building. So thank you, everybody, to the community, to the donors, to everybody on this call, and I will hand off to Dr. Qasba.
Thank you. Thank you, Barton. Thank you, Jacky and the foundation.
Sonia,
yeah.
Let me take a minute to introduce you.
Oh,
because you know,
sorry.
I love to sing your praises, and I got to have a chance to do that.
Okay, sorry.
That's okay. I can only tell the group here that if you're ever in a foxhole during a pandemic, make sure you have Dr. Qasba with you. You know, our system was our strength, and in infectious diseases like COVID, our system is well organized. Our representative to a system group that's called HEIC, Hospital Epidemiology and Infection Control, is Dr. Sonia Qasba. Now, Dr. Qasba is unique as a physician. She has expertise in internal medicine, pediatrics, and infectious diseases. So you can imagine that she doesn't have much time for anything else. She's also tireless and committed, and we've counted on her every single day. I want to mention something specific because she's going to go into details for you, but I think what kept our staff calm and focused, because our staff was plenty afraid, was that we could count on Dr. Qasba to come with us to staff meetings, which she did many times, and present herself in front of them. They knew she had her mask and her face shield and her gown on, as just like they did, and really reassure them about the situation, about the PPE, allay their fears. So her presence has been invaluable during this entire experience and will continue to be. So you're going to hear from someone who's a real expert now. So Dr. Qasba?
Thank you, Jacky, and Barton. Thank you for the handoff. I wanted to thank the foundation for this opportunity to present today. So just a little bit about who I am, my background. So my name is Sonia Qasba. I actually grew up in Bethesda, about a mile and a half from the hospital. So I frequented the hospital as a patient. I think I would have never imagined myself to be in a role where I could actually serve the community where I grew up. I currently live actually in the community as well. The pandemic came by, I guess, quite a surprise is what I would say. The management has been unbelievable to work with, been tirelessly here over weekends, transitioning us from the old building to the new building. The timing of that could not have been any better. It's as if someone knew something was coming to Suburban, and we opened up the new building just in time. Has a biomode floor, which is unbelievable. The entire building really saved us, is the way I look at it. The staff just has stepped in tremendously. And when I mean staff, I mean, you know, techs, nurses, physicians, all the support staff. Otherwise, our laboratory has been unbelievable, supporting us as we've had to transition to different testing methods. Hopkins has been an unbelievable support, has provided and helped us always with PPE, making sure that our staff stays safe, which has been the most important piece, I feel, that we have, that is an important role as my role as a hospital epidemiologist and as a hospital itself, to make sure our staff stays completely safe during a pandemic. COVID-19 is actually a very interesting disease process, because as we were moving forward, every day we felt like things were changing. The disease process was changing. We were learning as we were going, working through the toughest of times at Suburban, but nobody stepped back. Everybody was in this together every single day. No one wanted to turn their back to anybody or anything, or even our patients. One thing that I think is really important that we look at Suburban in particular is we actually had a great success because of the community. And what I mean is that our community was able to social distance, which was unbelievable. We have a community that is the catchment area of Suburban, where you're able to telework, you're able to work from home. We didn't have a lot of essential sort of quote unquote workers that live in the area that Suburban serves. What we saw at Suburban was very unique, I think. We ended up seeing a lot of patients that were from facilities, and we ended up seeing a large percentage of patients that are Latino, which are very much Spanish-speaking patients. These are patients that tend to be seen at some of our local hospitals within our county, such as Washington Adventist or Holy Cross. These hospitals really had a large volume of patients, and by default, a lot of these patients that normally go to those hospitals came to Suburban. So our patient population and our dynamics changed a little bit. We had to rely a lot on translation to be able to translate with these patients and take care of these patients. Something very unique about COVID-19 is it's a virus. It's in some ways similar to the flu, but in some ways it's different. And the things that were very unique about COVID-19 and continue to be so is that the presentation can be extremely acute. Majority of the patients who have COVID-19 are either asymptomatic or they can manage their symptoms at home. What we saw at the hospital are patients that are quite ill. And what I mean by ill is hypoxia was something that we saw over and over, requiring oxygen, ventilation, support. We also saw patients that presented with a significant shortness of breath. So, and the shortness of breath was interesting. They would come in very short of breath, but yet they were very hypoxic, not knowing that they were, even though they were able to communicate and talk to us and give us a history. So the other thing that's very unique about COVID-19 is that you develop an inflammatory response, your body does, which is very unique. And that's the part that's very challenging. And that's, I think, why we have a lot of mortality and, so to speak, deaths from COVID-19. So it's a very unique disease process. And what we did at Suburban was unbelievable. So a couple things that I think are very unique. We saw the first patient who was COVID positive at Suburban in terms of if you looked at the system level. So all the Hopkins hospitals, we were the first to take care of a COVID patient. We were the first within the county, within the Hopkins system, to cohort patients, as we did in the ER, as Barton had mentioned, as well as on the floor and ICU, which was unbelievable. And that was to really protect our healthcare workers and to be able to give appropriate care to our patients. Another thing that we did was unbelievable is that we were the first hospital within the system as well as the county to do our rapid testing. And I'll never forget, it was April 1st, April Fool's Day of all days. We went live with our rapid test. We weren't really sure how this was going to work, but it was unbelievable. So we could triage our patients properly, and that's really important. So we can put the patients who have COVID-19 on a COVID floor, and those who don't, we keep them off the COVID floor so we don't have any risk of nosocomial transmission of a disease, which we've had none at the hospital. Other things that were actually quite interesting that we did is that I thought was also very interesting as we went through COVID. Johns Hopkins, Maine Hopkins, and Baltimore was an enormous help to us. They were able to offload very much the sick patients. Otherwise, our volume at Suburban would have been incredibly larger than we had. Sibley, our colleagues, were able to help us with some of the non-COVID patients when we had no room in the hospital. So we felt like, the Hopkins system as a whole really came in and was able to provide us a lot of support, which I think was excellent. One thing that was really hard for us all is that we really don't have treatments for COVID-19, and that's something that everyone struggled with throughout the whole entire United States. So here at Suburban, what we were able to offer our patients are plasma, which was basically providing them antibodies so that they can fight the virus. We were able to give them a tocilizumab, which is an IL-6 inhibitor. IL-6 is a molecule that's part of an inflammatory response with COVID-19, so we were able to provide that for some of our patients. And then we started originally providing hydroxychloroquine, which many of you heard probably about on the news, that it was a great drug at the beginning, but as COVID came to Suburban, things started changing. The data started changing for hydroxychloroquine. And given our elderly population that we saw who already have cardiac abnormalities and arrhythmias, we had to change the way we practice and no longer provide hydroxychloroquine based on the data. So as you can see, it was a really changing environment as we went through the pandemic. And then the last is remdesivir, which many of you know about. It's a RNA polymerase inhibitor. Basically it stops the replication. It's very similar to Tamiflu if you look at it in terms of the flu. And we are able to provide that now to patients, but we don't have such volume as we had before. So a couple things that I wanted to mention as we sort of move forward with the future and what the future holds for us here at Suburban. I think one thing we have to keep in mind is that, in the winter months, I think COVID, as Jacky mentioned, flu, adenovirus, RSV, they will be presenting themselves again. I think one thing that I am personally trying to do, and with the support of the management at Suburban and Hopkins, is to see how we can work with some of the community. And what I mean by that is the Latino community that we have, which we have taken care of here at Suburban. Some way that we can develop a community-based pop-off testing areas. We can offer social isolation in terms of recommendations of where they can go, so that the hospitals can be seeing patients that are quite ill, and the volume hopefully can be lower if you can offer some of these options. We had a call today with our community colleagues, Monique Sanfuentes, and it went very well, developing collaborations with our county partners, which I think is really critical. And also Hopkins is going to be also developing such programs, because each of the hospitals got hit in particular with this patient population. So how can we work together to serve the community after all? Because 30% of Montgomery County is immigrants. And as we know, Montgomery County and PG County in the state of Maryland were the hardest hit. So there's more to come. I thank you again all for the opportunity to speak today. And thank you again to the foundation, and thank you, Jacky and Barton.
Thank you, Dr. Qasba. So wrapping this up, and before we get to the Q&A, our focus now is really turning towards steady state, or what we might call the new normal. And it's going to be the new normal for a while. So we're trying to determine, as I said before, how do we do our regular business in the COVID world and still take care of COVID patients. Now, Dr. Qasba told you that we're not cohorting. So as you can imagine, that means that as our patient numbers dropped, we had units with a smaller amount of patients. That meant we had to open additional units to accommodate our patients who did not have COVID. We have a lot of work still left to do. So we're not back to business as usual yet, but I wanted to share a little bit about where we are right now. So Monday, we started to ramp up and resume our elective surgeries. That is being done very cautiously and very carefully. First of all, we want to make sure that we've got the processes and practices of personal protective equipment in place. Patients are being evaluated for COVID before they have surgeries. So things are very different than they were before. The visitor policy remains unchanged. So visitors are not allowed into the hospital at this point. So we have to work out how we provide instructions for post-op care, et cetera, as well. And we're working on that. I expect over the next month or two, we'll be working through the surgical backlog, the cases that got canceled when elective surgery stopped. we want to stay very connected to our staff to ensure that they are still coping with the stress of the past months and the months to come, frankly. This was not without a toll on our staff. Our staff felt deeply the stresses of taking care of a unit full of patients all with the same disease and many not doing very well. Many of you know that we have many nursing home facilities in our area. We had a number of patients from them. Some patients did not survive their COVID, which meant that we had an inordinate number of deaths in a short period of time. Again, you know, this is always difficult for our staff. So we want to stay close to them. We've been very pleased that a donor is going to help us to continue to provide services that will actually help them with their resiliency. We want to continue to provide our community with the very best of care, just like we always do. We're doing it now as part of an integrated healthcare system. And we think that all brings much more benefit to our community than it could offer by ourselves. And finally, COVID is not the only thing going on in the country right now, and I wanted to mention that. And so we're focusing on that as well. Dr. Qasba, I think you talked about some of the cultural differences that COVID has revealed. And we're going to look for opportunities to work with our community to address these issues, because they do direct ourselves right back to health inequities. So in closing, I would want to, right before we get to Q&A, I want to emphasize again how moved I have been over the past months, just watching our staff, watching our physicians, watching our leadership team and my leadership team respond to the challenges of COVID. I felt proud to be one of them, of course, to be among them all, but I also felt blessed to be working with them. And now we'll move towards questions and answers. Cindy?
Thank you all so much. Really, I mean, we are so lucky to have these experts here and so many more throughout the hospital to provide this guidance and this experience so that we can take care of our community in such a great way. And I hope that everyone who's on the call really recognized really how lucky we are in this community to have this level of expertise. So I do invite people. We have a few questions up here on the on our Q&A section, which I'll start to go through. And if anyone else on the call right now would like to add a question, we'll be happy to take care of answering those. So Jacky, I know one of the first questions that's come in actually twice now is you mentioned that we're starting to reopen surgery and some of those other services. What about services like cardiac rehab, which is so important to so many in our community? You're on mute, Jacky. Jacky, you're on mute.
Thank you. Yeah, we know that cardiac rehab is incredibly important to our community. And we're really following the directions that the national experts on cardiac rehab are providing. So we are looking at a July 6th date to restart phase 2 of cardiac rehab. We're going to start it very slowly and in a measured way so that we can really meet the needs, most especially of people who have experienced recent cardiac events. Now to do this, we need to be able to spread the patients out over our gym. Our gym is rather small, so that we can social distance and exercise at the same time. So right now, what we don't have is a date for restarting phase 3, and that actually is congruent with the recommendations of national experts who are not recommending at this point that you restart phase 3 of cardiac rehab because of the risk of gathering in the gym.
Thank you, Jacky. I'm going to throw another one your way.
Sure.
The question is, let me summarize. The question is, what do we still need? So as we look to the future, you know, has COVID revealed anything that we know that we need to focus on as we move forward? Are there significant needs that the hospital is facing as we move into the future of medicine?
Sure. You know, I think that certainly COVID has put a spotlight on many things, including the way hospitals are designed. We are fortunate that in our building, somehow, some of us had the foresight, wasn't me, so I can't take credit, to design a unit in which the entire unit could provide that negative airflow that's needed to protect patients. That's all we have in that building. And so we have purchased equipment over the months that have passed to allow us to provide that same negative airflow in the patient rooms that were in the rest of the north building and in the south building as well. So there's needs like that. The resiliency needs are not insignificant. Technology needs. So for example, and this, donor opportunities and others, but what we have done to accommodate the fact that there have not been visitors around, which by the way has been incredibly difficult on our patients and on their families. What we have been using is the same thing we're using now, but we've been using it on iPads. And so outfitting ourselves with enough technology so that quite easily patients and families can connect on a regular basis. Our nurses have been doing this, but we kind of found ourselves shorthanded because we didn't have that number of devices. I'm going to invite Dr. Leonard and Dr. Qasba to the comment on what is it we think we still need. Do you have thoughts?
I got to tell you, I've been so pleasantly surprised in terms of what we didn't wind up needing, because I expected to have shortfalls in PPE. I expected to have shortfalls in staff. And I expected to have shortfalls in terms of just capacity rooms. And somehow between the planning and the real-time maneuvering and then acting like a system with the rest of the Hopkins hospitals, we didn't need those big picture things. What happened to New York, to so many New York hospitals, didn't happen to us. And if you've heard about, there are a couple other hospitals where they did have more needs than us, and they didn't have quite the capacity or as much resources. So we consider ourselves very fortunate. I will say that the food that came in was like just lifted spirits. That was a need for the last few months that was met and was really appreciated, because during those long days, it's funny, now there's new terms like people get PAPR and mask fatigue. Somehow it just, after doing 6 hours in one of those masks or one of those spacesuits, it's exhausting. But the food just lifted spirits, and that was really appreciated. We actually had a donation center set up that worked unbelievably well, and it was really nice to see the support from the community. But yeah, the big picture needs somehow we handled and we met beyond what I would have anticipated. So it was really nice to see. Sonia, I'll let you speak to anything you see in terms of needs.
Barton, before Sonia jumps in, I'm surprised you didn't take this opportunity to ask for an expansion of your emergency department.
Well, he's going to get that, so it's that's coming.
So it's interesting. I think I would have to echo a lot of Barton said. We really, things just fell really in place to help us in their time of needs. As I mentioned earlier, I think the one thing that's very unique about this disease is the fact that people are very hypoxic. So one thing that we sort of midway had to make some changes is to look for high flow oxygen to kind of support some of these patients, because they just have to kind of get over a little bit of a hump in terms of oxygen support. That's the only thing that I felt that when we were sort of going through, we had to kind of make some stretches and a lot of asks to kind of, because other hospitals needed it too within the system. So that was only one piece that I think, if I look back in terms of, something that may have been helpful. So
two things that I thought of, because Dr. Qasba is right. And I will tell you that myself and others fought hard to make sure we got more high flow devices. Two things we need. Number one, We need the community to keep strong and keep focused on this and not jump back to the behaviors we used to have because it's not over yet. I'm thrilled that we didn't get so overwhelmed that we ever had to make some of the difficult decisions like they've had to make in New York. But that could happen if we don't take it seriously. Second thing, bear with us. We know that this disease flip-flop practices that we used to hold dear. For example, like open access to our building whenever you wanted to be with your loved one. And we realize that that's a tremendous stress on family members coping with their loved ones' illnesses. And we're very conflicted about it too. So I know over the next couple of weeks, we're going to be having discussions. We're trying to balance keeping the staff safe and healthy and keeping the other patients safe and healthy with the needs that you as family members have to have access to your family when they're sick. And that, I think, has been one of the most distressing parts of this. So please bear with us. We understand how difficult it is. What we're trying to do is make sure that we keep the most people healthy and present to take care of your loved ones.
I couldn't agree more with everything that has been said there in terms of the community, what we need from the community. And the other part that I would emphasize is to make sure that that you know that we're a safe place to come to, and to not ignore symptoms and change your behavior and therefore make bad decisions. So I'm not going to say which one of my family members, but one of my family members, who's a very reasonable man, had chest pain. And when I said, hey, I'll meet you in the ER, just go over there, he's basically said, I ain't going. And it was out of fear. And I think that fear was present, especially during the surge and in the beginning. I think that's starting to change now. But people are making some bad decisions about their own health out of fear. And we're actually seeing it where people are presenting with later stages of diseases, where they're presenting a couple days after their heart attack, when that same person 4 months ago would have certainly shown up with chest pain before it progressed. Same with strokes, et cetera. So that's what we need. We need people to make good decisions and know that we are providing safe care and that the hospital is still a place to go and a resource for the community.
Barton, that's actually awesome that you just addressed that. That was one of the questions. Someone asked if there are limitations on going to the emergency department for non-life-threatening health incidents and issues. So I think you've just addressed that.
Yeah, absolutely.
Yeah, don't avoid the hospital if you feel that you need it, for sure. Jacky, I know you have to jump off to another call, but I'm going to ask you one other question that's appropriate for you, and then Sonia, I have a couple for you as well. Someone on the call asked, Jacky, what has been the financial cost of COVID on Suburban, and are we getting any support beyond our donors, like from the federal government?
Yes, there absolutely is a financial cost to COVID, as you can imagine, mostly because of the decrease in volume. And this is sort of the strange thing about this illness. When we first started, first of all, people stopped coming to the hospital, and Dr. Leonard experienced that extensively when his daily volume was cut in half, and it was out of fear. And then we canceled elective surgeries. So all of those things meant that we had a tremendous volume drop, and with the volume drop comes a loss of revenue. Now in Maryland, the financial system doesn't work like it does in any other state in the country. And that gave us a bit of an advantage in this, in this state, because we were able, as we have a global revenue, to still get some revenue. We are getting help from the federal government in the form of the CARES Act, and we have received distributions from the CARES Act. And the way it's working here is that then is in lieu of what would have been our global budget. So we're not profiting off of the disease. But the fact that Maryland has a slightly different system of being paid, in this case, has caused less immediate stress on the system. We still don't know how Maryland will resolve this in the long run, and it's such a complex system, it's hard to explain to you. One thing I can assure you about the financial part of this was when we were in the middle of this, and we continue to be in it, you know, we're really not focusing on that. We're focusing on safety, patient safety and staff safety. So we're not going to spare an expense to make sure that happens. Let me give you an example. It takes more people to take care of a COVID patient than a non-COVID patient, simply because you have to put on and take off this personal protective equipment. And you have to do it in the right way that you don't contaminate yourself and surfaces around you. And so we adjusted staffing accordingly. So clearly we invested more in the case of this for our patients, but we were not thinking about the financial picture. You hear all across the country what's happened to some of the other hospitals, and clearly there'll be stressors on Maryland hospitals too because of that. But we have been the recipients of CARES Act dollars.
Thank you so much, Jackie. Okay, Sonia, for you, two questions really, and we can sort of combine them together, maybe. As an epidemiologist, what do you anticipate when people talk about the second round and COVID in the fall, and how it will impact the community? And then the second question is about this new steroid that's been in the news, and how that might be beneficial in the fight against COVID.
So yeah, two great questions. I'm not sure I have the perfect answer for either, but so I do anticipate the winter is going to be probably, you know, so let me back up. So when COVID sort of arrived here, we were at the tail end of our winter, which was actually good because it allowed us time to sort of learn enough about it to prepare and get things in place. And so the goal would be this summer is to sort of prepare for the winter. So I do anticipate, you know, during the wintertime, we have not only COVID, we'll have the flu, we'll have RSV, which we see quite a bit of. It's all dependent on sort of how our vaccine does for the flu in particular and how good of a match it's going to be come the wintertime. You know, there are a lot of other respiratory illnesses. So I think, you know, we're preparing to have a testing ability here to be able to rapidly test all of those viruses so we can appropriately triage our patients and appropriately take care of them. So I don't know what will happen in terms of the community and in terms of things closing down, et cetera. But I do anticipate the numbers to be probably higher than what we have seen just most recently. In terms of dexamethasone, so this has recently come out, and it was actually quite controversial while we were sort of in the peak here at Suburban. Some of our providers felt that steroids was beneficial, some didn't, and as I mentioned, there wasn't any true treatment. No medication has been through a randomized control clinical trial to say that this is an effective drug to use. This was all throughout the United States, including what we had here at Suburban. But so far, there's been some data to show that dexamethasone, so a type of steroid, would be beneficial. As I mentioned earlier, that one thing about COVID-19 that's quite unique is that there's this massive inflammatory response that occurs, and perhaps the steroids can help with that inflammation, and that's sort of what we use steroids for usually. So I think there's more to come. I think we need a little bit more data. We are getting prepared in terms of our formulary here. We already spoke with our pharmacy teams to make sure that, you know, as we approach the winter time, that we do, if dexamethasone proves to be significantly in terms of helping our patients, that we're ready for that here.
Thank you. That's so helpful. I see that Jackie has stepped away, but I think either of you could probably answer this question. From a, well, actually, Sonia, I think I'll go back to you for a second. Someone on the call asked if you could highlight a little bit about our COVID statistics in terms of patients who are surviving and, you know, and leaving the hospital, maybe length of stay, or, and then, of course, you know, we did have a number of patients who did pass away. I know we don't want to go into real specific numbers, but I think you had some statistics. Sure.
So, so I think one thing that we did see with COVID-19 in particular is around sort of day 5 to 7 of sort of symptom onset is where we saw if you were not going to do well in terms of requiring oxygen or becoming hypoxic, you would require some sort of oxygen support. Thus, patients would come to the hospital. it's hard to say how people are going to do. The people who went home, I know I've been in touch with several of them. They've done well post-COVID. I do think there's some studies that are going on to see actually what the damage is or what the impact is on lung pathology or lung tissue. And I don't think there's a lot out there, but, you know, as we mentioned, unfortunately, and it wasn't only here, but in all over the United States, the nursing homes and facilities sort of got hit hard. And unfortunately, what we saw with that patient population is the nutrition support was lacking, because it tend to cause significant amount of weakness and fatigue, where people ended up not being able to eat or have enough nutrition support. If there's anything else, I'm happy to answer, but you know, the patients did do well post discharge. And there's some serology studies that are looking at people who have had COVID. You know, what is their serology? And these studies that are going on to look at appropriate serology testing are still in the works. I wouldn't say there's any particular serology test that's better than the other. I think there's a lot more to come regarding that.
Okay.
And just one thought about the statistics question. One piece that was sort of interesting is our hospital had the highest % positive for patients tested in the entire system. And I think that largely reflects the fact that Montgomery County was an epicenter in the state of Maryland. And we sort of got hit early too. Part of that is because if you think about the DC area, it's more international, and we had a lot of that international travel coming from Europe and from some of the other countries that were epicenters early on, much more so than Baltimore. So Baltimore lagged and didn't have that same high percentage as the DC area, and then especially Montgomery County. But that was an interesting statistic that we followed for a long time.
Yeah, so I appreciate Barton's, I forgot to mention that, but yeah, so what Barton said is I totally agree with, but you know, we do have an international population here, and it did show with our COVID testing. You know, we had, which was great, we had a drive-through testing ability, which was fantastic, that we were able to support that for the community in particular, because as Barton mentioned, people didn't want to come to the emergency room. And so, you know, people were sick and they wanted to know what their COVID status is. One point that I just wanted to make, if I could just take a second, it's a great article in the New Yorker by Atul Gawande, who's a very well-known physician up at Harvard. And he has stated, and it's a wonderful read if you have time, and it talks about the 4-drug therapy that he suggests for COVID, and in terms of a respiratory illness, and sort of taking you as a human being taking a lead on when you get sick. And the 4-drug therapy that he suggests is as follows. The first is to continue to wear surgical masks, and the goal of that is for you, if you are asymptomatic carrier, to protect yourself from spreading the virus. The second is hand hygiene. Wash your hands frequently. And we do that a lot in the hospital. I mean, in and out of rooms, we're constantly doing. I probably do more at the hospital than I do at home. The third is when you're sick, to seek care and to isolate yourself from others so you don't transmit the disease. And so it's very interesting if you look at that article in particular to see you know, what the read is on that. And that's sort of to look at not only COVID-19, but moving forward as we move through the winter months in terms of what will be coming.
Sonia,
I'll also circle back around to the question about needs. I know we have the new hospital, and it's fantastic, but there are a couple of units, including the emergency department, the one that I live in, that is needs some updating, some expansion, some refreshing. There's also going to be needs in terms of mental health. We're already seeing an uptick, and we do have a sort of a specialty care area. We are a hospital that has a psychiatric floor, and we're seeing now post-COVID a uptick in mental health needs. So that's another piece that I think, you know, in terms of donor money, helping both of those pieces. And then our trauma center, which really is a resource for the entire county, because we're the only level 2 trauma center, and that always needs support. We're taking care of not just Bethesda patients, but patients all, in the entire catchment area, and it's just something that's fantastic that we provide to the community, and that we always have needs for donor support.
Thank you, Barton. That's super helpful. And I know, for everyone who's on the call, in addition to everything that's going on from a public health perspective, from a social justice perspective, we also know that there's also a huge economic impact going on out there. But every dollar that comes in here to support this hospital is one that is turned back around to support our community. And I think these guys have really demonstrated that. So we are enormously grateful to our donors. I'm sure that there are a few questions that we probably have not quite gotten to yet. And if anyone wants to send those to us, we're certainly happy to respond to you. But we do want to be respectful of people's time. And we know that people signed on to this webinar for about an hour. So I leave you with my gratitude. I know Jackie already had to step away to another call. Barton and Sonia, thank you so much for joining us.
Thank you, Cindy.
And
I just want to make one quick comment if I can. So we had the Resiliency Center. we had the Resiliency Center was very on point here. I actually several times when I wanted to take a break in between my shifts, just go upstairs and just relax and have a cup of tea. I'm a big tea drinker, so that was actually a very peaceful place for you to collect yourselves at times in which it was quite difficult. When you had a lot of sick and ill patients in the hospital. So that was very on point and quite helpful. And I know a lot of my colleagues felt the same way. So so that was great.
Yep, taking care of mental health is going to be as important as physical health during this whole COVID pandemic.
Yeah, that's a really great point. And I know these guys have emphasized, I'm so glad you brought up the Resiliency Center, because that has been really, really important to all of our staff. And I know even just looking at the statistics very early on in the month of April alone, we had more than 400 clinical providers visiting the Resiliency Center itself, not to mention the therapists who were going out and doing some work on the units directly. So, so the mental health of our staff and the resiliency of our staff has been super, super important to keep everybody going during this long haul of this pandemic. So anyway, thank you all so much, and we would love to do more of these. So please feel free to reach out to us if you would be interested in being added to our list for these donor Zoom webcasts. And we're so grateful, and we hope that everyone has a great evening. And most importantly, please go out and continue to stay safe and stay healthy. Thank you so much from all of us.